Well, thank you for inviting me. I'm very happy to talk about what I think are the things that we should be focusing on about digital and mental health. And the first thing I want to say, and it will be said by a lot of people, is that actually there's been a lot of investment in some very high quality services, things that will really make a difference in areas like cognitive behavior therapy, certain areas of depression, even virtual reality with people with serious mental health issues. And it's very, very positive in the way the field is developing, good evidence that it's working, helping psychotherapists to reach patients who can't attend appointments face-to-face, and lots of different ways in which we'll therefore increase the capacity of services, lots of different ways in which we can help people to find resources in their everyday lives. And that's all a big positive. But we also have to look at the gaps, and we have to look at some of the risks that are emerging. And I think the first things that I would focus on is the biggie, which is suicide rates and the vulnerability of people in their digital lives on the internet, for which has been a growing public concern. And the truth of the matter is that the only way we really tackle that is by starting to put a kind of protective cloak around people, by starting to demand higher standards of privacy and security, and by being allowed people, when they're starting to explore things like depression or the fact that they have suicidal ideation, that there's automatically an extra level of shielding that goes around them, and they have more rights and more control over what happens with their data. And that can be done technologically, and I would like to see more embracing of that. I work for a company called humanity.co, which is focused purely on how we can give citizens more control over the data and their privacy on the internet. So I think that's one big area, and I'd like to see big progress on that and focus on that. I think the second thing, which is slightly different, having worked in digital health services over the last 7 or 8 years in cancer and cardiovascular disease and looking at mental health, there is a general trend of, as we invest in digital health, quite rightly so, that we can automate more things and we start to take things into a slightly more dehumanized process. And for a lot of things, that's fine. For diagnostic quality and so forth, I think that's a really good thing to do because we can do a lot more, and that releases a lot more time for professionals to spend on care. But at the same time, I don't see a systematic investment in our nursing capacity, in the capacity of mental health professionals to spend face time with people who really need that close connectivity. We don't necessarily have a strategy that's working. It's not that it's a problem that hasn't been identified. It's just that we are happy and perhaps being put into a false sense of security by how well digital is working. We're not getting the people interaction right. So I think in mental health, more integrated perspective on the system and how we're actually going to meet the needs of people, not to be socially isolated and to have access to people who can really help them, is the second leg of the stool. So that's, with greater protection on the internet and greater investment in the digital services that work in the moment, they're the 3 legs of the stool that I think are really important. And I greatly appreciate being able to come here today and talk about the other 2 legs as well as the success that we're seeing with digital health. Thank you for listening.